So I'm here today. I'm really excited to be here with one of our Georgia representatives. Roger Bruce is with me, and we're going to talk through some of the questions that you may have and what's going on in COVID world for Cobb County. So thanks for coming, Representative.
Glad to be here. And, it's interesting, as we were talking earlier, that, you're saying it's going down, but the news reports are reporting that it's going up. And people are confused right now. So what's really happening?
Yeah, so that's a great question. So I'm really happy that you asked. So there are different things happening throughout the nation right now, right? So everybody is aware that we have been on that Delta surge now for, so we started about July 4th weekend, and so we're into the third month of the Delta surge. And what we've seen throughout, whenever Delta has hit in different areas, like in the UK or India, it seems to be this 2 to 3 month period that it will quickly rise and then kind of burn itself out. And that's what we're seeing here as well. And so we are seeing our cases come down right now. And so we may get a little bump from fall break. We hope that we're not, but we are definitely on the downslope of this. So that is some really great news. That being said, we're still at 303 cases per 100,000, which is still high transmission, okay? So remember 100 over 100,000 is what's considered high transmission. So we're 3 times higher than that. So we're still in high transmission, but we're seeing a lot of the numbers come down. Hospitalizations in our area are coming down as well. So I know they're all relieved to see that. And we're seeing the percent positive of tests coming back. That's coming down. It's finally gone below 10%. So we're about 8.3%. And that's important because, it means less and less people are spreading it around and are coming back positive when being tested.
Right. But when people talk about this in terms of percentages, we're still talking about people. And so, we may not be having 100%, but even if it's 50 or 20% of people getting sick, that's still a lot of people. So we want to make sure that people are not taking that for granted and not saying because it's coming down, I can relax.
Absolutely, absolutely. And that's a really good point. And so we had talked about this of, Representative Bruce asked if I felt comfortable being vaccinated to go out and do whatever I want to do. And that's not really the case. So I do a lot of prevention, right? So we're always with our masks. And if I go into stores, I wear my mask. I avoid large crowds of people. And, especially you don't know if people are vaccinated or not. And you also don't know if their vaccine coverage is holding up at this point, right? We don't know those kind of things. So as we see that, we're all praying that this is going to, peter out by springtime. But in the meantime, it hasn't yet. And you're absolutely right. We are still in high transmission, so we still need to do these things.
And what about the children in terms of schools? As you know, I've been advocating that these schools should not be open until all of the children are eligible to be vaccinated.
Yes.
And some schools are open, some schools are not open. Kids are getting sick. They're taking it home. Parents getting sick. Yeah. So what would you tell our school systems?
Well, it's a delicate balance, and I understand that. We know that children, they need to be in school. Like we all agree with that. So for their, emotional health, education, social health, it's important that they be in school. But we have to try to balance that, right? And I think what we've seen multiple studies and multiple different situations where you can try to do it safely, So if you're over the age of 2, you gotta have your mask on. So that's very important. Being able to spread out is very important in classrooms as well as not sending your kids to school sick. I've heard a lot of concerning stories about kids are going to school sick or waiting on a pending test that comes back positive, and then you expose a bunch of other people. So these are important things to be able to do when you are trying to keep a school open. Also, we're all praying October 26th is when the Pfizer is going before the FDA for approval for 5 through 11-year-olds. This is going to be a much lower dose, and they've shown that to be very effective and very safe. And I heard an excellent interview yesterday with one of the Emory physicians, infectious disease doctors, that was talking about how this trial, people think that it was rushed and it's not as safe. It is done the same way it is done for other vaccines and medications. a lot of the barriers have been taken away, but these medications and vaccines have been shown to be very safe. So I am looking forward to that because I have an 11-year-old. And I can't wait to get him vaccinated. So it's important, once you are eligible, to get that vaccine for your kids.
And now with these booster shots, when are the boosters going to be ready? Do you know?
Yeah, so that's a great question. I got a little cheat sheet here. So right now we have Pfizer that's available for the booster. Remember, the third dose is always available for immunocompromised people. So whether you got Moderna or Pfizer, if you have like a transplant or something like that, you are eligible to get that already. Now, what we're talking about is the third dose in the series now, the booster dose, okay? This one is eligible for Pfizer now. So if you are over the age of 65, you can get that. Or if you have, you live in a long-term care setting or congregate setting, or you work there, or in a high-risk like healthcare setting, you are eligible to get your Pfizer. Now, I know not everybody got Pfizer, right? So I would not mix and match yet. That is not, that has not been recommended. But next week, Moderna is going before the FDA. And so we are waiting for the approval for the Moderna booster at that time. So things are happening very quickly. And so we look forward to Moderna being available for probably the same group of people. And then soon after that will be for the children.
Okay, I'm going to put you on the spot with this question. As you know, the General Assembly, we will be going back in session on the 3rd of November. And right now, what they're telling us is that we're going to be back in the chamber as normal. Yeah. But things are not normal. Yes. And so if you had an opportunity, you know, to address that issue with the Speaker of the House, who decides how this is going to lay out, what would you recommend that we do?
Well, you know, I would recommend what we recommend for everybody else as well. So you're right, this is not over yet, and the things that prevention-wise we're asking to do that will save a lot of lives are really minor inconveniences. So we do need to have people wearing masks. That makes a huge difference. You all are lucky enough to have, you know, resources available to you. So, you know, testing people, surveillance testing would be something that I would suggest as well. And if you can spread out a little bit, but I know it's difficult. If you're not going to spread out, then making sure you have.
I'm going to spread out. I'm going to sit out, and when it's time to vote, I'll go in.
Exactly. But yeah, just making sure that you have some of those things in place. Let's not pretend like, you know, there's no danger.
Like it didn't happen. Yeah, because, you know, they've taken down all of the signs, you know, all of the markings, you know, for 6 feet. All of the signs in the elevator, you know, saying don't crowd in here. They've taken everything down, and it appears that nothing has ever happened.
Yeah, I see that
but it's not normal. Yeah. And right. So I'm concerned about that.
You're absolutely right. But make sure you do what you got to do to protect yourself.
Amen. I'm gonna sit in the hallway, look at it on TV, and when it's time to vote, I'll go in and vote.
There you go.
You know, as we spoke about earlier, also there's. You know, every report you look at just about is different. You know, we get different information from different sources, and people are flat out confused. Yeah. How do we deal with all of the misinformation that's out there?
Yeah, so that is something that we're battling every day here, and it's very difficult because we actually have seen kind of some high-level people, elected officials, that are putting out some bad information that is really very risky to people's lives. And so, you know, what I advise people is, you know, you have to use some science here. You got to trust the people that this is what they do, and go to trusted sources. Be very careful if you are going to, you know, fringe sites of, you know, of kind of pseudoscience or people that have nothing to do with science. You know, I see people that will listen to people who are not scientists, not doctors, not, you know, anybody that you should be listening to about these kind of things. And, you know, you ask yourself, well, you know, would I let that person treat me for diabetes or my heart disease? You would never let some random person who is not a physician do that to you. Why?
People that don't know what they're
exactly. So why would you listen to them about, you know, why not to take a vaccine, why to take a anti-parasitic medication or other arthritis medicine instead of COVID vaccine? Why would you listen to them about that versus, you know, the people you should be listening to, and showing that these medications are safe.
Right now, there's still confusion also about testing and whether or not testing is available free. Is it?
Yeah, so thanks for asking that. So first of all, there's so many testing options available right now, right? A lot of these home tests that you have, these are those antigen tests. They're pretty good. They're not the best tests to do, but if you have symptoms especially, then they're pretty good tests. So you can do those. But if you get, for example, let's say I was a close contact to you who has COVID, and I don't have any symptoms, not really, we're pretending. Or let's say I am a close contact to you, and then all of a sudden I get symptoms, and it looks like COVID, but I take one of those tests and it says negative, right? But I know, maybe you had it, so that doesn't make any sense. So kind of use some common sense. So that test may have a false negative. So you have to follow it up with the gold standard, which is that PCR test, right?
Nostrils.
Yes, in the nostrils. It doesn't go all the way back anymore, but just a self-swab you can do. Well, we have those available. So what's important is a lot of the places that you'll go to, you'll get charged for those tests. And to go on trips on airplanes and stuff like that, or different events, you're going to need to have some proof of a negative test. So that's the kind of test that you want to do, is that PCR test. We opened a new site, and we're really excited. It's at the Epicenter in South Cobb. They're there Monday and Wednesday from 8 to 3. It's completely free. If you have insurance, they may charge your insurance, but if you don't, no problem. You'll get the test within 2 days, and you have your gold standard proof so that you can go on your trips. But I want to make sure everybody knew that was a new location that we had available, and it is pretty slow, so you can get a spot really quick.
Well, let me ask you this, because you raised another point. You say it takes 2 days to get the results. Mm-hmm. Okay, but if you are positive and 2 days go by before you know you're positive, how many people have you come into contact with?
So that's a great question. So suppose I am getting the test because I want to go to Aruba, which I really do want to go to right now. I don't have any symptoms. I'm not a close contact, nothing. But I do the test just because, right? You're okay. Now, suppose I am a close contact to a bunch of people, or I work in a nursing home that maybe has some positives, or a hospital that has some positives, or if I have any symptoms. If you're doing the test for that, then you need to make sure you're quarantined before the test result comes back, okay? If you are in a situation where you're not sure either way, make sure you're wearing the mask, okay? And that will protect against giving somebody else the virus inadvertently. Okay? All right. Why are we here today?
I'm getting the flu shot.
You are?
And, from what I've been told, and I'm following your advice, that even if you've gotten the vaccine, that has nothing to do with the flu shot.
Absolutely.
Two separate things.
You're
Is that correct?
right.
And so I don't want to get the flu. I don't want to get the virus. So I'm following your recommendation to get shots for both.
Yeah, and he heard I was the best person to get the shot from, so that's why he came all the way over here.
With the smallest needle.
With the smallest needle. So what's important about the flu? So last year we had next to no flu season last year. You remember that?
That's what I was told.
Yeah, so every year we usually have a lot of flu cases. We had next to nothing last year. We were wearing masks, we were staying home, we were locked down a little bit, right? Equals no flu season. This year's going to be a different story, all right? We have a lot more people that are congregating and people that have come from different places, and so we will see more of a flu season. So that's why it's very important. You did not get a good exposure last year, so your immune system is not going to recognize it as well. So it's important that you protect yourself with the flu shot so that you don't get sick from the flu.
Let me ask you, this is a real one of these doctor questions, okay? If last season, the flu, there was no flu, pretty much. Where did it come back from? I mean, where does the flu, if it went away and it wasn't there, what brought it back?
That's a great question. So, flu is one of those things that we look at, like kind of the animal population across overseas and see, what may be brewing and things like that. But we can tell from other countries that have a flu season first. And then that gives us an idea of what we may be seeing as well. And so it's a lot from the traveling and intermingling of folks. So, why does flu and common cold, RSV, why do these things keep coming? Well, they just get the opportunity to, and so they take their chances.
They say they want to stay alive too.
That's right, they want to stay alive too.